Good afternoon. This is Larry, and I'm coming to you live from Stevie's room. Today's topic is feline stomatitis and other dental issues. Finding a good dentist for your cat is not that easy. So, the field of feline dentistry is not at the forefront of the field. But your cat is going to let you know when it has a problem. And they do have problems, similar to what people have to some extent. Um, and they're going to let you know. Symptoms to be on the lookout for are drooling, pawing at the face, like as if to say, this hurts over here, flinching at food, and that can range from they pull the food out of the dish onto the floor and eat it on the floor, and they're hesitant with it, or actually all out, take a bite, scream, ah, and run away. And they're afraid of the food. And if you find yourself chasing your cat around the house when you think it hasn't eaten with a whole bunch of foods like a smorgasbord, well, then you know you got a problem, and it needs to be addressed. Common things with the cats that when you go to the doctor are the most frustrating, feline stomatitis. It is an inflammation of the gum. And I've had a variety of different vets treated a variety of different ways. One vet wanted to pull teeth, and I read online that's something to do. They didn't pull all the teeth, but they pulled a lot of teeth on that cat, and it still came back. It helped a little, but did you really have to put the cat through all of that? I don't think it's bad to pull a few teeth that, if it's like so inflamed in that area and the tooth itself is in bad shape, then okay. And don't get scared when I say the word tooth extraction. I've had tooth extracted, and if done properly, it's actually better than some of the other drama that dentists put you through. Because once it's out, there's no more pain. And there's no more problems that are going to happen to a tooth. You're not going to get a cavity or a this or a that. It's done. It's done. Of course, and with a cat, they're not as glamorous as we are. If it's a canine, so what? Let them pull the teeth if they feel the tooth really needs to be pulled. They will not go through the same kind of pain that a person will, and even as a person, if it's done properly, it's not going to hurt that much, really. Teeth cleaning. A lot of general veterinarians like to do teeth cleanings. Look, I've had negative experiences with dentists. I also remember sitting at lunch with a person I worked with in my 20s whose dog died from anesthesia in a routine dental cleaning. That's not to say that it can't be done or shouldn't be done. It's just that I pause, okay? And that's just me. You now have heard all the pros and cons. And yes, it's good to do the cleaning of the teeth, but look, when the time comes, they're going to pull the tooth. They're going to deal with the abscess. They're going to deal with the stomatitis. And cats don't live as long as people do. So these problems don't develop until oftentimes till they're at least middle-aged. And there's a lot of other problems that can develop way before teeth issues or older age, and they can be managed. There are certain foods that are a little bit easier on this. First off, if you think your cat's not eating, chances are it might be eating. It waits for the food to get a little dried out, and because the juice stings the mouth. And it might just be grazing on the food. So you really sort of do need to keep an eye on it if it's really not eating at all, as opposed to is it grazing. Foods that I've had success with, but I'm not talking about extreme success. It's just they'll try it at least, and maybe you eat a little bit of it. Um, Baby cat pate, that's one of them. It's made for kittens. It's bland. It's a pate. You can mix it with a little water and a little bit of ice, so it's cooling, like crushed ice, a little bit. You can even mix it with KMR that they give to kittens, like a little puree, because it really is made for kittens. Um, but that's why it's so bland. And you really want your cat to eat, because if it goes a certain amount of days without eating, it starts going into kidney failure. So you really don't want it to go too long without having food. Um, Another one, and you need a prescription for this, is AD. Also with a little water, sometimes a little ice. AD is a critical care food. It's not a food that you can feed your cat as a diet staple. It's a food that is used for emergency type situations. And if your cat hasn't eaten in a few days, that's emergency. Feed it. And if it needs this because it's bland, then it's high calorie food and it is beneficial. Um, I avoid saying people foods. I don't like to feed cats people food. They generally don't eat people food anyway when they're this bad. In desperation, I've tried like tuna fish to see if it'll get, and they might eat a little bit of it, but tuna fish should never be a part of a cat's staple diet. It really shouldn't be. And absolutely no milk. And absolutely no deli meat. The nitrates and preservatives in that are just awful. And they don't deal with this. I refrain from people food. It may be a last ditch effort, a little bit of tuna with water, to see if it'll try and eat anything. Um, and but by then you should be gearing up towards getting it to the veterinarian. If you find yourself like with 5 different dishes of food around you, and you're like going to the store to buy tuna fish, then that um, you know this needs to be addressed. So with that in mind, be safe, be well, good luck, and I hope this helps. Thanks for listening.